Hi everyone, I am Dr. Neha Agrawal, and today I am going to share my story, my journey from being a clinician and anesthesiologist to now becoming a digital side hustle and core strengthening coach for healthcare professionals. This was 1978 and I was just 13. We came to Delhi from Meerut when my father was admitted in one of the best private hospitals in Delhi for the treatment. But unfortunately, within 2 days of his admission in the hospital, he left us all alone in this world. Our whole world crashed. My mother's whole dreams and world crashed. She never even for a second thought that my father would not come back home. She thought doctors are God, but are we? I am not blaming any of the doctors, but it so happened that my mother was not appropriately briefed about my father's prognosis. That day, I felt something very hurtful inside. To fulfill the dream of my father and with the wishes of universe and God and with the support of my mother, I became a doctor. And throughout my clinical career as an MBBS doctor and as well as when I became an anesthesiologist, I was very communicative with my patients and their relatives about their risks and complications, their prognosis. I was also very communicative with all the staff as well as all my colleagues, as I always wanted that there should not be anything amiss, at least because of the communication part. And then second incident occurred in 2002 when I was working in one of the best private hospitals of Delhi as a consultant anesthesiologist. It was the evening, the last case in the OT when I was shifting the case from the OT to the ICU, which was in the same OT complex. And I had just settled that patient that a nurse from the other bed screamed that one patient had collapsed. I started the CPR procedure, but when I asked for the life saving drug, injection adrenaline, the nurse told that the ampules, injection adrenaline, were expired. I just screamed to bring the drug from the OT, which was brought, and luckily we could save the patient. But as I was putting my notes down, I realized that my hands were shaking, that my whole body was trembling. I had sweat over my forehead because the thought, what if the drug in OT was also expired? And my whole memories of my father's death came at that point also. That hit me very hard. And the same day, late in the evening, I called my OT in charge, the sister in charge from the ICU, and also the pharmacist from the hospital. I asked them to bring their stock books and I learned their stock management because we doctors don't read about the inventory management. And at that time, I did not know what is NABH accreditation. There was no NABH. What is ISO certification? The hospital had just started the ISO certification processes. And I'm not also blaming those nurses there because those were really good nurses. But it so happened those days, those tighter protocols, systems were not there. So I just sat and learned how they manage their stocks, and I made those pointers that how they will check in every shift the stock, their expiry dates, and how they will be returning, what minimum stock level they will maintain. And in fact, the same thing I asked the pharmacist to do. And the pharmacist told that he had put the orders to the vendors, but there was delay in the supply. But then everything was told to everybody about the minimum stock level, the extra stock level. At that time, I did not know about these minimum reorder levels, the buffer stock. And I got all those pointer checklists made and got it pasted the same day in the OT ICU and gave it one list to the pharmacist. And that was the day when I was born as healthcare safety specialist. And then I just kept on from then onwards making system and processes in OT and ICU. And as the years went by, I became the part of all the quality committees of the hospital, became internal auditor, and also did my healthcare quality courses. I became an ABH assessor. And in the meantime, I also became the head of the Department of Anesthesia and Critical Care. And I was going for the accreditations all over the country. And whatever I used to learn, I used to come and get it implemented in my own hospital. As well as whenever I used to go to any other hospital, I used to do in my best ability to tell the practical points also, as I was being already working as a head of the Department of Anesthesia and Critical Care. And as the years went by, my vision became to go into this administrative area of the healthcare so that I can have better control of healthcare safety system and processes. And I did my MBA in healthcare administration. And as the luck would have it, that the same organization where I was working since 2001, it had collaboration with one of the bigger organizations of the country in 2017, which had almost around 25 units all over the country. And as the luck would have it, I was given the opportunity in 2018 to become the regional quality head of the same organization, which I grabbed with both hands. And I was looking after the 3 units of the organization: the Jammu unit, the Delhi unit, and the Gurgaon unit, for making all the healthcare safety quality process and systems. But as the luck would have it, the COVID struck in 2020. And in 2021, a time came when I had to choose between being as the healthcare safety specialist or go back to the anesthesia. There was financial crunch everywhere. I chose the latter part of being a healthcare safety specialist. And it so happened that my post of regional quality head of the North region was abolished in 2022. And the 31st May 2022 was my last day in the same organization where I had given my blood and sweat for more than 21 years. I was devastated. I did not know what to do, how to proceed. I had never imagined this in my life, ever. But somewhere in those days, I had a belief, as those were the Mata Rani days when I was told that my post is being abolished, that there must be something positive, there must be something good for me in store. But as my journey started from there in 2022, I had a lot of multiple challenges. Although I launched my Healthcare Integrals website, started writing blogs, healthcare safety related, I became active on LinkedIn and other social media, especially on LinkedIn for writing my blogs and my thought processes. I had the opportunity of being into the administration part in one of the organization which I joined. It so happened that I was getting the offer of going into director anesthesia or maybe director anesthesia plus the medical director, but that was not my vision. I knew it that if I take the director anesthesia part or an anesthetist part, my focus will shift from this healthcare safety. I cannot apply it on a wider scale. What my vision was so that I can have my contribution of safer healthcare system in the country by contributing into the whatever organization I work with, having a better control on safety protocols, systems and processes. As I was working in this 2022 November, I joined that administrative post of making healthcare safety system and processes. In 2023 October end, I got the offer of becoming medical director of one of the organization where I had to look after their 4 units. And I happily took it as this was my dream job. And 2000 November 23, I joined this job. But again, as if universe had some other plans for me. There was no salary for more than 2 months in the same organization. And I resigned in the second week of January 2024 from my post of medical directorship. Again, I was very depressed. I thought, why it is happening with me? And as I was active on LinkedIn, by end of this January 2024, I came across one of the posts of one of my mentors and I joined his webinar. And then I never looked back. I kept on doing multiple mentorship programs, the courses, the law of affirmations, manifestations, gratitude journaling, going into how to make the systems, how to have your own entrepreneurship journey. But as I was progressing through this, the realization hit me very hard. I realized even joining these mentorship programs, I found it very difficult to align with everyone. I felt isolated. I felt nobody is really going to understand me. And since 2022, one feeling that really carried with me, which was very hurtful, was there was no one to hold my hand. There was no appropriate guidance from anywhere. Only guidance if I got from anyone was everyone was saying, go back to anesthesia. And I felt from my heart, how can I go back? I would not be happy. Whatever I had in my childhood, whatever I had in my career, my vision was to work for safer healthcare systems in the country. And that was the point when I started my entrepreneurship journey in 2024. Initially, I was thinking I'll be doing it in 2022, that I will be doing something of my own also and do something, join the job also. But as if universe gave me that direction to come out. And when this entrepreneurship journey started in 2024, the realization, the real purpose hit me very hard, that I have to hold the hand, I have to create something for the healthcare professionals. I remembered all those healthcare professionals who had also lost their jobs. And I knew, and I know now also, there are so many healthcare professionals who had lost their jobs and they are still in the same thing, that they have not got their dream job, but they are jumping from one place to another, because most of us, in fact, I would say all of us as healthcare professionals, be it doctors, nurses, administrators, quality specialists, because since long we've been working in healthcare sector only, we think we cannot do anything without the hospital or the clinics. But I came to know of the solution during my entrepreneurship journey, that yes, as healthcare professionals, we can do so much of the things. And that's why today I am working as a digital side hustle and core strengthening coach for healthcare professionals. Because the realization came, if the healthcare professionals are not safe, if they don't feel secured, if their future is not secured, how can the healthcare safety progress in a manner or with the speed with which it should progress? And today I am on that journey. I have launched my exclusive community for healthcare professionals as healthcare integrals. Have my platform coded courses, the community, the live sessions, where I'm there to guide each and every healthcare professionals to have some side hustle, online digital coaching systems and processes with their knowledge and skills, be it healthcare related or non-healthcare related. If it's healthcare related, definitely their reach of the safer healthcare system will be much, much wider in the country or maybe even globally. And if it is non-healthcare related, then in my community, I have my basic healthcare safety course, which starts from the home of healthcare professionals. Because multiple times in my career, in my life, we have seen, and even at my home and place, we have seen that we are focused in hospitals and clinics, but we are not taking care of ourselves, or we are just in our busy world, we are running and we are not giving any mindful or thoughtful attention to ourselves and our family members. And the errors are occurring at our own home. Like even simple thing like having grab bars in bath area and the toilet area. I have been to so many healthcare professionals' home. It's not there in 100% because somehow we don't think about these things. And if anyone comes in my community, that pointers are there, so they become more aware and focused that healthcare safety will start from their own home with themselves, and that itself will create a wider reach of safer healthcare systems. So if you want to have a secure future in life, if you've been there, if you feel stuck in your life or career and you feel that you don't have any solution where to go, then I have been there and I am there for every one of you, all healthcare professionals, be allopathic or non-allopathic, everyone. So do join hands with me and start a new chapter of having your own security for a future safer healthcare systems.